Hello, my name is Zoe Pofu, and I work in the Joint Information Center as one of the public information officers in the Emergency Operations Center, or EOC. Today is March 27th, year 2020. Today's update will include the following: an overview of the current COVID-19 case count and situation overview from Dr. Jennifer Mullendor, Interim Public Health Director for Buncombe County. Additional answers to your questions from the public about stay safe, stay home declaration and emergency operations preparations, provided by Fletcher Tove, Public Health Preparedness Director for Buncombe County, and Taylor Jones, Buncombe County Emergency Services Director. Updates from Asheville City Schools and Buncombe County Schools. Information about the One Buncombe Fund from Tim Love, Intergovernmental Affairs Director for Buncombe County, and Kit Kramer, Executive Director of the Asheville Area Chamber of Commerce. Updates for Mission from Dr. William Hathaway, Chief Medical Officer from Mission Hospital. To begin, Dr. Mullendor will provide and deliver a situation overview.
Good afternoon. I'm Dr. Jennifer Mullendor, Interim Health Director for Buncombe County. Since yesterday's media briefing, we have been notified of 3 more lab-confirmed cases of COVID-19 in Buncombe County residents, bringing us to a total of 17 cases. 12 of the 17 have recovered from their illness and have been released from isolation by Buncombe County Public Health. The ages of our cases have ranged from people in their 20s to people in their 70s. No new cases have been reported in out-of-state travelers to our county. Over 1,200 tests have been performed by Buncombe County healthcare providers and Buncombe County Health and Human Services since the start of the outbreak. All of the Buncombe County community testing site results have returned, and one of our additional cases announced today came from that final day of testing. We know that due to limited availability of testing at this time, there are very likely many more than 17 cases of COVID-19 in our community. We also know that people with COVID-19 may spread their illness before they show symptoms of illness or before they recognize their mild symptoms. All that leads me to say that we acknowledge our inability to have an exact count of the number of cases in our county at this time. However, as more testing becomes available through commercial labs and health systems, we expect that our accuracy of what's going on in our county will improve. At this time, we must assume that COVID-19 is spreading in our county and that, each individual we may encounter could have it. And that is why we have implemented the restrictions and pushed forth the recommendations to stay at home and to follow the basic preventive measures of hand washing, limiting your contact with others outside your immediate household, cleaning and disinfecting surfaces that are touched frequently. It is critically important that each of us do our part to protect ourselves, our families, our friends, our entire community. And I'm sure everybody's getting tired of hearing me say it, but again, as we said, this is a marathon, not a sprint. It is critically important that we continue to take these actions seriously in order to prevent further spread in our community. And if you, again, have questions about COVID-19, I would refer you to our website, buncombeready.org, and the handout that is there that goes over what to do if you think you have COVID-19, when you should call your healthcare provider, and what your family members should do. I'm now going to turn it over to Fletcher Tove.
Good afternoon. I'm Fletcher Tove, Buncombe County Public Health Emergency Preparedness Director. Today I'm going to continue to clarify the Stay Home, Stay Safe declaration and address some of the common questions we're seeing. But first, I want to alert everyone to some anticipated action later this afternoon from Governor Cooper. We know that Governor Cooper has delayed his daily media conference until 4 p.m. today. And at that time, we are anticipating that he will be providing further guidance for a statewide response to COVID-19. We don't know any specifics at this time, but we can anticipate that there may be some aspects of his guidance that are either more or less restrictive than our local Buncombe County declaration. Buncombe County government has the best interest of Buncombe County in mind. And going forward, our guidance may not fall directly in line with guidance from the governor. As we receive this information from the governor this afternoon, we will be working to evaluate where our guidance differs and will clearly communicate that to the community. Now I'll address some questions we've been receiving from the public and media partners. Is there a curfew? No, there is no curfew in effect for Buncombe County. The Stay Home, Stay Safe declaration is a standing declaration effective from 8 p.m. yesterday to 6 a.m. on Thursday, April 9th. Do essential workers need credentials or passes for travel and transit in Buncombe County? No. Buncombe County is not taking any actions to disrupt or limit transit on roads. We are only asking that people limit their travel to essential travel only. At this time, essential personnel and businesses do not need any credentials or pass or any form of paperwork to be on the roads. But the bottom line is that if you don't have an urgent or pressing need to be out, you need to be at home. Are legal services considered essential? We've received a number of general inquiries for the clarification concerning how legal services fall between essential and non-essential categories. Legal support and the support of essential businesses and essential functions is inherently essential. Our guidance has consistently been that essential businesses may be open to provide services and that individuals may leave their residence to receive those services. For any other legal activity, it's up to the individual attorney to determine whether a service for a client or a potential client is reasonably mandated. Is there a donation site for personal protective equipment drop-offs? We have been receiving many offers for turning in unused personal protective equipment, or PPE, for emergency responders and healthcare workers. We are very grateful for these offers, but we also want to ensure that we have a procedure for an accurate inventory, quality assurance, and distribution of those supplies as they come in. We're working towards that solution, and on Monday, we will have a standardized process that we can share with the community. How is the county continuing to work through the waiver issues for essential businesses? Thursday, we mentioned that there had been over 600 requests, and have we managed to get in touch with many of those businesses? So through all our sources since Wednesday, we've received near 1,000 questions about essential designation for local business. of the hundreds that we've already responded to, about 95% of those are clearly specified in the declaration or interpretive guidance as essential. So I ask everyone with a pending request to again take a look at those source documents on buncombecounty.org, read them, and if your business is covered in that guidance as essential, please understand that you default into essential status. You do not need a letter or approval from us. Has the county reached out at all to rideshare services such as Uber and Lyft to give them any guidance on best practices for cleaning vehicles, and can they continue to operate under the Stay Safe, Stay Home declaration? So Public Health has confirmed that rideshare services have been receiving guidance from the CDC and public health officials in regards to best practices for transit operations, hygiene, sanitation, and coordinated with their local public health. These rideshare services have regional managerial teams, and the guidance is being pushed to all drivers through regional directors nationwide. Finally, there's been guidance from Commissioner Troxler, who's over agriculture, that the green industry employees, including landscape services, are exempt from local stay-at-home ordinance. And there's been conflicting information from the county and the state. So Commissioner Troxler's statement reads, nursery operations, garden centers, landscape and maintenance operation in companies critical to the environment and physical living conditions necessary in our communities. Buncombe County does not deem lawn maintenance to be critical over the next 2 weeks. However, our declaration has clauses for helping your neighbors and supporting the elderly, even if they are paying you. Our declaration also has clauses for minimum business operations, where a minimal number of employees can work to maintain the business and its equipment. We don't want people traveling together in truck cabs to work sites, and we don't want people having close-quarters lunches on job sites. We want to ensure that all Buncombe County residents, whether on essential business or not, are maintaining their distance of 6 feet. In closing, I want to reiterate the intent of our Stay Home, Stay Safe declaration, and that is to keep as many people home as possible to ensure that opportunities for close contact are reduced as much as possible, and we can work together as a community to protect our most vulnerable. Thank you. I'll now turn it over to Taylor Jones, Buncombe County Emergency Services Director.
Good afternoon. Buncombe County, through its Emergency Operations Center, has been keeping in constant contact with our regional medical partners. The role of the Emergency Operations Center is to receive and process requests through our healthcare partners and to assist with coordination of resources at all levels, both local, state, and federal. We are actively engaged with all of our local, state, and federal partners to ensure that planning efforts are ongoing for surge capacities and for continuing both the local, regional, and federal conversation about how to have appropriate emergent surge capacity in the event of this crisis gets to a much larger basis. We've been working on this process now for several weeks. We've made a lot of strong headway, and I want the citizens of Buncombe County to be confident that we're going to be prepared. This is a continuing process of wrapping up resources and working with our local and regional emergency management partners so that we can have a regional approach to this kind of epidemic response. So in closing, I would like to say that all of our partners have really stepped up, and we're going to have the capabilities to the best of our ability for not only Buncombe, but working with our regional, state, and local partners so that all of those processes work uniquely together to provide the best level of services for our citizens. Thank y'all.
Good afternoon. My name is Ashley Michelle Thublin, and I'm the Executive Director of Communications for Asheville City Schools. Today, I am speaking on behalf of our amazing Director of Student Support Services, Ms. Kadada Wynn, and her staff, who were unfortunately unable to be here this afternoon because they are actually in the midst of hosting a free drive-through food market for our families with less access. Therefore, echoing their words, first and foremost, we would like to give a huge thank you to all our student services colleagues, both in Asheville City Schools and across our community. You have been working tirelessly since day one, and we so appreciate how our students and their families remain your #1 priority. Asheville City Schools has been focusing on our families with highest needs this week. But a little bit more about our Student Services Department and their efforts as a whole throughout COVID-19. Thanks to our counselors who knew this would be a trying time for many, there were social emotional lessons sent home in our elementary schoolers' first round of at-home learning packets, as well as additional resources in our latest batch that were picked up just this past Wednesday and Thursday. Additionally, similarly to all of our teachers, some of our secondary counselors have social emotional learning lessons that students are able to access through Canvas, which is our e-learning platform for 6th through 12th graders. Students, regardless of their age, additionally have the option to set up a Google meeting with their individual counselor if they would prefer some one-on-one time. This can be done by simply emailing your school counselor directly to determine a time that best works for both of you. Additionally, in the midst of all this unknown, our secondary counselors are busy working on registration and college recommendations. They are having a future-forward mindset and using virtual communications as well to best support our students. Our social workers have created a central hub for parents to visit if they find that they are low on food resources. This hub is located at one of our schools, Isaac Dixon Elementary School, and has been a very resourceful place for all of our families. We are also working even more closely with the Asheville City Schools Foundation in regards to receiving and utilizing monetary donations to best support all of our students. We're also utilizing our Purposity app, which is allowing us to order necessities and have things delivered straight to our families' homes. We have been meeting families at grocery stores, using Instacart when available and Amazon to ensure families have access to fresh fruits, veggies, meats, and maybe even a roll of toilet paper at Whole Foods. We've made sure medications were filled, paying special attention to our homeless families and to those of us who take care of elderly grandparents as well. Plus, it sounds simple, but it has had a tremendous impact. Our school social workers have also walked neighborhoods just to lay their eyes on our families to ensure they're remaining safe and answer any questions they may have. Our social workers have also been very resourceful in creating reminder sheets to empower families in establishing sustainable, realistic habits and sharing with them the schedules of resource sites, meeting them there upon the family's request. Our mental health staff, in collaboration with our contracted mental health agency, which for Asheville City Schools is Family Preservation, has made an effort to contact every family that is on their caseloads. They are available via phone and other virtual options, of course, as long as they're HIPAA compliant. They have been making sure that all families know that they have support options if they find that they are not stable mentally. All families were given the Asheville City Schools Crisis Hotline, which for our Student Services Department is 828-333-3676. 828-350-6133. Again, that's 828-350-6133, as well as their family preservation contact number and RHA's mobile crisis contact. Our nurses have also been extremely helpful and available with everything from passing out academic packets to answering the same health question for the 100,000th time. Our volunteers and community partners, such as United Way, Hearts with Hands, MANA, and 211, just to name a few, have been beyond supportive. We are grateful, and we will continue to fight this good fight. And besides our tremendous student support service staff, I am proud to say that our principals and our teachers have made it their goal to call each student within their building and within their classroom, just to let them know that we care for them, we are missing them like crazy, and to find out if there's any way that we can support them during these unprecedented times. Our district has also made several social media posts explaining to our families that if their child would like a handwritten note of encouragement, my department, which is the communications department, is more than happy to send a letter their way. It is quickly becoming my absolute favorite part of the day and is an excellent opportunity to continue to connect with my students from afar. So far, we've sent about 60 letters, and we'll continue to do so until our local grocery stores run out of stationery, which I'm not anticipating anytime soon. A reminder to all of our families, please continue to check our emails as well as Asheville City Schools website and social media platforms like Facebook, Twitter, and Instagram for the latest news on how COVID-19 is affecting our school district. We understand the importance of mental, social, and academic balance, especially during a trying time like this. Truly, we have a heightened level of gratitude for our student services team, and once again, we say to our families, we see you, we hear you, and we are here to support you any and every way we can. Just let us know how. Finally, we would like to remind those who are working on the front lines to remember to practice some self-care and keep your families first. We know that your hearts are huge and you are working your absolute hardest to serve this wonderful city that we call home, but we also know that we are no good for anyone else if we are not well ourselves. Thank you. And at this time, I'm going to turn it over to Buncombe County Schools.
Good afternoon. I'm David Thompson. I'm Director of Student Services for Buncombe County Schools. And just want to direct the comments that I make today from our district around students' social, emotional, and mental health needs. We're hearing from many of our families that you are experiencing stress in your household, you're experiencing stress because of your jobs are in jeopardy. We're hearing our students experiencing stress because they're doing things in a very different way. As part of our Buncombe County Schools Compassionate Schools focus, our counselors and social workers are providing telephone or video counseling to any student who needs that level of support. They're also posting social emotional skills lessons and strategies that students and parents can use to help them better respond to the stress that they're experiencing. We know that when any of us experience stress, our brains create chemicals that make our bodies feel upset. The skills that we teach help us to be more in control of our body's response, and then better able to think of next steps that we take. These are essential skills not only for now, but for our students and for your futures. As educators, we recognize that families have had to change their daily routines very quickly and may feel really unprepared to provide the supports that their students need educationally or socially. All families are going through the same, often rocky, adjustment to this new and temporary setting. We want our students to learn every day, and to feel but to do so, they need to feel the need for some sense of safety and calm. If your children cannot complete every assignment, or if you have technology challenges, we have teachers, counselors, and technology staff available to assist by text or by phone. The numbers are available on the Buncombe County Schools website at buncombeschools.org. Please don't be afraid to reach out, even if you don't know exactly what to ask. We're all in this together. Also, our children need to feel some sense of routine or sameness every day, so use of some schedule to help them organize their day helps them to feel that sense of safety and calm. We're also grateful for the close partnerships we have with our local and state mental health providers. We have created solutions with them to keep our students connected to mental health services that they need, despite our transition to virtual education. Our local mental health providers are now able to provide services by phone, by video connection with the students on their school's device. This should be happening now. Remember, how your children feel during this time will be more important and more remembered than the instruction that they receive. We don't want schoolwork to make your homes more stressful. Instead, we want it to be a meaningful and hopefully enjoyable part of your child's daily routine. Don't expect virtual learning in the home to be an exact replacement of a typical day in school. It won't be, and that's okay. While the way we do it may be different right now, our school counselors, our school social work, and our mental health partners are ready to offer services and supports to help our students grow both their academic and their social emotional skill. Now, just like always. Thank you.
Good afternoon. I'm Kit Kramer, the president of the Asheville Area Chamber of Commerce, and now chair of the One Buncombe Fund. At the Chamber, I work with people, my staff, volunteers, members, and our strategic partners who understand that we're stronger when we work together, that together we're more than the sum of our parts, and that's why I'm here today. That's what community is about. And our community is struggling right now. Some have lost their jobs through no fault of their own. In the first week alone, it's estimated that over 10,000 of our citizens lost their employment, and the layoffs continue. Some who have put their heart and soul into establishing the businesses that make this area so special, so authentic and unique, they're at extreme risk of not being able to restart. We're in uncharted waters, and none of us knows how things will play out. While we're hopeful that businesses will be able to reopen and those who have been laid off will get rehired, we can't just rely on hope. The One Buncombe Fund was created to minimize red tape and move as quickly as possible to provide immediate assistance to our community in two ways. First, to provide financial support now to those who have lost their jobs due to COVID-19 while they're awaiting support from state and federal resources. Second, it provides loans now for local small business owners who are trying to keep their businesses afloat. Tim Love is going to fill you in on all the details of those relief efforts in a few minutes. I'm here to deliver the message that the more money we can raise, the more small businesses and laid-off workers we can help. Our cities and county have shown leadership by creating this fund. We're now turning to those in our community that have been more fortunate, who haven't lost their jobs or been shut down because of COVID-19, to join us in helping our neighbors. Right now, you can go to onebuncombe.org and press donate and make a contribution of any size to say, yes, together we're stronger, together we're more resilient. We are one Buncombe. We plan to not only reach out to all of our residents through social media, but to approach foundations that can be of assistance and companies that can help. I am so pleased and grateful to those who have already stepped up to show they understand that the need is now. The Buncombe County Tourism Development Authority was one of the first to make a donation of $50,000 to help. And yesterday, we learned a gift was made by our good neighbors of the Biltmore Lake Charitable Fund and the Ramble Charitable Fund, who have made a combined contribution of $200,000 that they are presenting as a challenge for matching grants, gifts, big and small. We are just over $500,000 in contributions as a start, and while that's great, it will go awfully fast. Because you love your community, because you love the small businesses and the people who work for them, because they make this place so special and a place we all live in, I urge you to do two things. First, go to onebuncombe.org right now and press donate and give what you can. And if you have the ability to issue a challenge grant, please do. We'd love to talk with you about that. Second, share the information about One Buncombe on your social media using the hashtag OneBuncombe. And get those kids who are out of school outside with some chalk and busy chalking their driveways and other areas with the One Buncombe hashtag. If you're a business with a sign, we'd love to see One Buncombe on that sign, or incorporate it into your email addresses. Let's bring it to everybody's attention. Do these things so that together we can meet local needs right now as One Buncombe. Every little bit helps. And Tim, I will turn it over to you for the details. Thanks.
Thank you, Kit. This is Tim Love, Buncombe County. I think Kit outlined pretty well the need in our community. We're aware of the economic impact here. I think Kit also did well to describe the call to action, the need for us to come together. If you're sitting at home wondering, why should I donate? Or if you're sitting at home thinking that you need relief, that's what I'm here to talk about. I want you to understand the scope of the program, the eligible folks who can apply, and I want you to be comfortable with your donations. So who is eligible? There's two buckets of funding here. One is for individuals who have lost employment related to COVID-19. The second bucket relates to small businesses, and those are defined as businesses with less than 50 employees. There have been many questions about eligibility, and so I'd like to clarify. If you're an individual who's a 1099, you qualify. This program is designed specifically for you. If you've lost employment related to COVID-19, this program is for you. If you're a small business who is potentially shuttering your operations, this program is for you. We've had many questions about eligibility and just wanted to clarify. Additionally, we've had questions about what types of support are available. If you're an individual, the support method for you is direct assistance grants. These grants can be used for many different purposes. The grants will be administered directly to service providers. There will be no cash provided in hand. But the eligible uses include mortgage payments, rent, utility payments, and other sources. After you reach out to us, our caseworkers will work with you to identify any other sources of funding available for you so that we're not redundant in the usage of One Buncombe funds. If you're a small business that's applying to this program, you're eligible for a low-interest loan up to $10,000 in the near term, and this loan will have no payments for 6 months. This loan program is designed specifically to be a bridge program. When we say bridge, we mean this is a loan product that'll get you from where you are today to greater relief from small business disaster relief loans. There have been questions about the timeline. When will these funds be available? The answer is simple. You'll be able to start applying today, and funds will be available next week. In terms of when do we start? It's a great question. We start now. Kit articulated the onebuncombe.org website, and I'm here to reiterate it. After this press call, our website will be live, and you'll have the opportunity to go and donate. And additionally, if you're seeking relief support, you'll have the ability to apply as either an individual or a small business. Before I close, just want to leave you with a few thoughts. There's no doubt that these are trying and uncertain times. I believe these are the moments that define us and that will define our community. I'm certain that we will all be defined by our generosity and service to one another. Even though we are apart, we can come together as one Buncombe.
Good afternoon. I'm Bill Hathaway, and I'm the Chief Medical Officer at HCA Healthcare, the North Carolina Division, and Mission Health. It's a pleasure to be back in front of you again with an update about what's happening in the health system and a few specific references to some issues that have been coming up recently. We remain at this point in time, as Dr. Mullendor pointed out at the beginning of this press conference, on the early edge of the curve of cases in our community. We continue to identify a handful of cases each day, both in Buncombe County and throughout the region, and we remain gratefully with a relatively low census of confirmed COVID-19 cases within the hospital, currently having just 2 patients in-house. I'm fairly confident, but not happy to say that we'll be seeing more patients in the coming weeks as testing results become available and as the disease spreads, as we know it will, through our community. It's critically important that I echo and emphasize the words that were spoken previously about the need to adhere to the Stay Home, Stay Safe campaign. The way that our health systems in this country and locally will handle this epidemic for you and to keep you all safe and healthy is through your help by flattening the curve. I know that there was hope on certain people's parts that we could end this isolation by Easter. I want to be clear that most of us in the healthcare field find that to be optimistic at this point in time. We'll reevaluate, but as Dr. Mullendor pointed out very nicely, this is a marathon and not a sprint, and we're in the early phases. A couple of specific references which I'd like to talk about. Number one is our visitation. I think you know that in our health system, we have restricted visitation to the highest levels right now. We call it level 3 restrictions. This means that essentially there is no visitation except in select circumstances. These select circumstances include pediatric patients, patients who are in labor, patients who are at end of life, and certain other situations where caregivers are absolutely necessary for patients who might otherwise not be able to help themselves in the hospital. We are screening at the doors actively, both for exposure history and symptoms, and we're asking respectfully that you stay home at all costs. Secondly, I'd like to address an issue related to our personal protective equipment. There seems to be some questions about our policy, and I want to make some clarifications. The first and most important thing is to emphasize that our policies around personal protective equipment are designed to do one thing and one thing importantly, and that is to keep our patients safe. It is critically important that when patients come to the hospital, we keep our patients safe. And in order to keep our patients safe, we must keep our employees safe. And so we have and will continue to adhere to CDC, the Center for Disease Control guidelines on the use of protective equipment, face masks, gowns, gloves, shields, etc., to protect our patients. Those guidelines are on the CDC website and on our website, and we'd like to refer you to those. There has been a lot of question about staff members wearing their own masks in the hospital or wearing masks in situations which would not otherwise require a mask for protection either of the patient or the staff member. We recognize and appreciate the anxiety that surrounds this illness and the risk that people take working in a healthcare environment. That is not to go unnoticed, and believe me, we are fully aware of that. At the same time, we have been concerned that the injudicious use, that is, the non-necessary use of personal protective equipment, will put us in a desperately critical shortage at a time when we need this equipment most. That's when we have lots and lots of patients to take care of. We have looked at health systems across the globe, be it in China, Italy, or Iran. We've looked at health systems in the United States in hotspots where there's many more patients being cared for, and the number one and most significant concern that they've run into is the availability of personal protective equipment. We have absolutely no reason to believe that we will be immune from that. We are procuring equipment in all venues. We appreciate the outpouring of support by our community members to make donations, as Mr. Tove alluded to earlier. That is heartwarming and endearing and unbelievable to see the community pull together. At the same time, we must do everything we can to now preserve and protect our equipment for when we will know it later. We don't believe that we are putting staff members or anyone else at risk with our current policy. That being said, we have made a change recently because of the dynamics of the situation, and we'll continue to look at the situation as it evolves. We are allowing staff members to wear personal masks when they are in situations which would not otherwise require protective equipment. So if you are in a patient care situation where we know isolation is mandated, we request that our staff members use our masks in that setting. It is the only way that we can ensure both their safety, the staff member's safety, and the patient's safety in that circumstance. But if they want to wear other masks that they provide themselves in non-care settings, we're happy to accommodate that at this point in time. Thank you very much.
This concludes the presentation portion of our community briefing. I want to give thanks to all of this afternoon's contributors and to you all who tuned in to become informed. Our goal is to make sure that all members of our community have the information they need to be safe during this COVID-19 pandemic. As we said yesterday, we understand that the community has many questions about the COVID-19 response in Buncombe County. And as we head into our third week of the COVID-19 response, here's what the community can expect from our EOC regarding COVID-19 community updates starting this weekend and beginning Monday, March 30th. There will be no community updates from the EOC scheduled for this weekend. Mondays and Thursdays at 2:30 p.m., we will continue to offer community briefings via Facebook Live. In the event that there are any major changes in the weekend, we will use every available communication channel to provide information to our community. Please visit buncombecounty.org for information on COVID-19, and also, if you have questions regarding the One Buncombe Fund, please call 828-250-5500. Thank you again. Be well and stay safe.